Hey there, I'm Dr. Jim Collins. Thank you for stopping by. I have an important topic. I've talked about this one for quite a while live, all over the place. It's the emotional needs of the rehab patient. Many older adults and seniors may seek a skilled nursing facility for a short-term rehabilitation stay. It's very common, happens every hour of the day, every day of the week. The main goals are usually to provide physical, occupational, or speech therapy after a surgery, an accident, or perhaps a stroke. Individuals may be dealing with pain related to fractures, post-surgical conditions, spinal cord injury, or head injury. And while these therapies are necessary, don't want to downplay them, the individual may experience a variety of other emotional needs that should not be ignored. Healthcare professionals should be aware of these needs and then be prepared to effectively help. There are reactions to disability and loss. Receiving short and even sometimes longer term therapy might bring about certain losses to the individual that carry significant emotional reactions. Very basic things like activities of daily living or independent activities of daily living may become impaired, leaving that individual feeling helpless. Social roles like being a grandfather or a career person getting ready to retire, these might be lost for a while and leave that individual feeling depressed. There may be other worries associated with a rehab stay as well, including financial security, future living arrangements, and the need for social support. Common reactions to rehab conditions, there are many. Changes in one's physical abilities and the pain associated with rehab can bring on a variety of emotional reactions. And it is not uncommon for people to experience anxiety or depression, or most likely both at the same time. Some people will express anger and frustration about their conditions, and some people will withdraw, fade away, stay in their room, things like that. Depending upon the person's personality, one may experience decreased self-esteem, stress, fear of more loss, PTSD, post-traumatic stress disorder, and distorted body image. I'm not the person I used to be. Some reactions might be biological, including disruption in sleep or appetite, sometimes both. And it's not uncommon to fear pain and becoming addicted to opioids. That's a real thing. That's a real issue. Here's some other possible reactions. Fear of becoming dependent on other people. Feelings of vulnerability, guilt, fear of further loss, retaliation, aggression, agitation, fear of losing relationships. So you see, when individuals seek skilled nursing, rehab, short-term, long-term, whatever the case is, yes, we're going to provide physical therapy and occupational therapy and speech therapy and all these wonderful technologies. But let's not forget, the individual also has emotional needs, and we should be able to recognize them and then respond appropriately. I'm Dr. Jim Collins. I'm out of time. Take care of the emotional needs of your rehab patients.